You're listening to Health Professional Radio. My name is Wayne Bucklar, and today my guest joins me from Melbourne in Australia. His name is Dr. Andrew Ronchi, and he is from Door Sophie. Door Sophie is not a brand name that I was instantly familiar with. So, Andrew, welcome to Health Professional Radio.
Thanks, Wayne.
And can you enlighten me about Door Sophie? What is it that you do?
We produce wearable sensors and a medical-grade wearable, so quite different to the consumer wearables. We produce a wearable that you're able to put on different parts of the body to give an accurate quantification as to how people are moving.
Okay, so this is not to be confused with the kind of fitness bracelet thing.
No. Our sensors are cleared with the TGA for Australia and cleared with the FDA in the United States as a medical-grade product. So give accurate measurements to clinicians and to elite sporting teams and even in the workplace as to how athletes, patients and workers are moving.
I see. Now, in terms of geographical footprint, you mentioned America and Australia. Are you active in both those markets?
Yes, active in Australia first, and then we moved to the UK 2 years ago, and we've launched in the US in the last 12 months.
Well, our listeners in the UK may be more familiar with you than I am, but I have to admit it's a product I wasn't familiar with, and it seems like from your website that it's able to produce an extraordinary degree of accuracy.
Yeah, so we've modelled it on the quality data that comes from a movement laboratory. You would have seen different movies and different sports teams go through lab settings. So we've made sure that each one of our applications is tested against the gold standard, which is the laboratory setting. So, yeah, we are able to give very accurate movement analysis and muscle activity analysis.
Now, Andrew, most of our audience are clinicians of one kind or another, and some of them are musculoskeletal experts, and lots of them are just in acute care settings and in aged care settings. Is there a message you'd like to get them to hear as a result of having heard you on the radio today?
Probably that I'm a clinician by trade, so I worked as a physiotherapist for years and felt that whilst my eyes were good at picking up a lot of attributes of movement, they couldn't see things in 2 and 3 dimensions, and I certainly couldn't see things more than 20 times a second is how our eyes work. And the data we capture can pick up things like, is someone at risk of a stress fracture in elite level sport, or is a patient at risk of falling in their gait pattern, or is a person ready to return to play after they've had a knee reconstruction. So the things that challenge a clinician, I think we're able to provide some insights in those realms to give the clinicians more confidence and engage their patients about some of the more subtle parts of human movement.
You mentioned a frame rate there. Andrew, is this linked to a video recording?
Correct. So we capture video as well as movement as well as muscle activity, and we're able to combine those in real time. So when you play it back to the patient or the athlete or the worker, they're able to see themselves moving, they're able to see the movement deficiency that's described in numbers and colours, and it's an education forum for that patient or worker or athlete.
It does sound quite extraordinary, given that from a patient's point of view, I have had physiotherapists telling me to do things over the years to twitch that muscle or tighten that one there, and quite often it's not obvious to me what they're talking about. It does sound like it, from a patient education point of view, it would be ideal. Yeah,
we're able to provide some clinical evidence around the use of this technology, Wayne, in treating people with chronic lower back pain. So we ran a randomised-controlled trial that tested if you had accurate data in the clinic and you're able to share that information live with the patient on a computer screen to engage them and teach them how they moved. And then the third thing was to reinforce those positive movement patterns away from the clinic over 8 weeks. Would that fundamentally change their improvement to low back pain? And that's now published, and it's a great paper. So if people are interested in being able to engage patients in their movement patterns and give them long-term results for a condition like lower back pain, that's one of the spaces that we specialise in.
Yeah, it's always nice when there's evidence to support things, I find. That's a published paper is a very good way to do that, and I'm sure we'll have some interest in it. You're listening currently to Health Professional Radio with Wayne Bucklar, and my guest is Dr. Andrew Ronchi. Andrew's the Chief Executive Officer with Door Sophie, and we've been talking about their range of movement sensors and, I guess, wearable technology at a clinical level to treat patients with conditions affecting movement. Andrew, my favourite question in every interview is about misconceptions. There are misconceptions, I guess, in every field of endeavour and all the work we do. What's the greatest misconception amongst your, customers, clients, patients, clinicians? What's the misconception that drives you nuts and keeps you awake at night?
The comparison to other more consumer-based products out in the marketplace. People think that you put us on the wrist and it gives you some information about activity levels, and we're very different to that. We'll put the sensors, if you're running, we'll put the sensors on each leg and we'll tell you how much time your left leg's on the ground compared to the right leg. If you've got a back problem, we'll put the two sensors on the back, and it'll tell you exactly how your lumbar spine's moving. So a lot more about detailed movement analytics than general activity levels.
Yes, I can understand how that the predominance of those fitness bracelets would be an issue to get the differentiation across to your market. And I guess they're spending millions of dollars on television advertising and chasing a mass market, and that's not the kind of market that you're pursuing. No,
we're not a mass market company. We're more so to give specialised movement information. And a good example is some of the sporting groups we're working with. It's a validation point for us that Manchester United have just signed up for a third year with us, and the groups like the Golden State Warriors over in the US, as well as the New England Patriots and LA Lakers, are using the technology to understand how their athletes are moving in a detailed way.
And at a clinical level, is it being purchased by practitioners or by hospitals or by patients? Who is the customer at that clinical level?
The customer is absolutely the clinics themselves and the hospitals. So we've got NHS hospitals in the UK, we've got 130 clinics in Australia that range from major hospitals through to pain specialists through to physiotherapists. And in the US, it's the clinicians, which they call themselves physical therapists in the US, and some of the surgeons, especially along the east coast of the US.
Andrew, thank you for your time today. It's always fascinating for me to hear about the range of products that apply technology that I'm just unaware of, and I guess that's testament to my ignorance more than the marketplace. But I realise you're a busy person, and I do thank you for your time today. How can people best get in touch with you?
Probably the best contact is the website at www.dorsaVi.com, or my phone number is relevant, especially if you're calling from Australia, and it's 0417 88 2267.
And if you're calling from either the UK or US, you need to add +61 to the beginning of that and drop the leading 0. And that website again is www. And it's spelled DORSAVI, dorsaVi.com. Andrew Ronchi, Chief Executive Officer with dorsaVi, thank you very much for joining us on Health Professional Radio today.
Thanks very much, Wayne.
If you've missed my conversation with Andrew, the good news is we have a transcript on our website. There's also an audio archive on YouTube and on SoundCloud, and you can find links to all of those resources on the Health Professional Radio website at www.hpr.fm. You're listening to Health Professional Radio. My name is Wayne Bucklar.